Celebrate. Connect. Arizona Hispanic Connection.
Welcome to AARP Arizona Hispanic Connection for another very informative show. The topic today, HIV, no respecter of persons. Again, HIV, no respecter of persons. I want to remind you that this show is being transmitted also via Facebook Live. If you do Facebook Live, you have your page, and you haven't followed us, please visit AARP Arizona Hispanic Connection on Facebook and follow us. And also, I'm asking you to share the shows. We are addressing very, very important topics, such as the one today, HIV, no respecter of persons. I have three guests with me today, and I'm going to introduce them. And as I usually do, just going from my left to my right, all right? So let me see if I get this right. Jamie Romano?
Yes. Hi.
Jamie Romano is the Director of Marketing and Events at Aunt Rita's. Aunt Rita's, huh?
Yeah.
Who is Aunt Rita's?
Aunt Rita's Foundation is an organization in Arizona that does a couple of things. They fundraise in Maricopa County to provide grant services to organizations that serve individuals with HIV or who have been affected by HIV. So,
How long have you been doing HIV-related work?
I personally have been working in HIV prevention and education for the last 4 years or so. Yes.
Good. Welcome, Jamie.
Thank you.
All right. And then we also have Erica T. Camp. I got it right.
You got it.
All
yes.
right. T. Camp works for an organization that I don't want to say that Aunt Rita is not dear to my heart, but the area agency as an agent is dear to my heart. I'm very familiar with the Medicare. What is it called? The
Benefits
the
Assistance
SHIP
Program,
program.
SHIP program,
Yeah, the
yes.
SHIP program, Benefits Assistance Program. And not only that, but my daughter works for them too. So I guess I'm biased.
Okay.
Andrea.
We'll have to talk about. Oh, Andrea's
Yeah,
daughter.
she is my
she's
daughter. So,
wonderful. Yes.
Erica, thank you so very much for joining us. You are the director of HIV Care Directions with the area agencies on Aging Region 1. Just briefly, what is the Care Directions program?
Yeah. Well, thank you for having
Mm-hmm.
me today. Care Directions is a program that serves individuals 18 and older. So we have lots of older adult clients as well. We help them get connected to medical care, medications, and all kinds of social services so they can live a long and healthy life with HIV.
Perfect. Thank you and welcome again.
Thank you.
We also have Joe Ray. Last names are not too bad for me this time.
You got it.
I got
for
them
you.
all. And you were invited. And by the way, hopefully Glenn Spencer will listen or watch this show. I want to
better.
thank him. I want to thank him very much. He literally put together or produced, as they call it. This is the technical term is produce, right? I usually am the producer and the host and the whole works, and it's a lot of work, I know. But this show, he literally produced it, and I'm so thankful to him. And we really wanted Glenn to be with us. He couldn't. I think he's in Washington, D.C.?
Yes.
I believe
Yes.
he took a trip, right?
Yes, he did.
So Joy Ray, he really wanted you to be here in the sense that you bring in the experience. You are living with HIV since you were 50, or you are 50 plus.
Way plus.
Way plus?
Yeah.
And you have spoken, he said that you have spoken Aunt Rita's on their issues, and I assume events. So, Joy, first of all, thank you so much for making time to be with us.
Oh, thank you very much for allowing me to be here.
Yeah. We have about 6 minutes for the first on the first segment, and I want to ask you a first question. If someone asks you, what are your opening remarks, right? Because I usually do this. I kind of do a little research, and I type a little paragraph, and I kind of set the stage. I put these issues that we address in a proper context. So rather than me doing it, I am going to ask you to do what you would call your opening remarks so that the audience will kind of know what we're going to be talking about today, and that would be basically the context. So why don't we... Let's start with you. What would be your opening remarks regarding this issue of HIV?
I was diagnosed in October of 1990. I was 35. And at that time, it was still considered pretty much a death sentence. And I was told that very day that I might live to be 40. And at 40, I was very ill. And if anything, I'm always prompt. But it's been a long road of a lot of prejudice, stigma. For many years, the government wasn't much help. And I've seen history change so much, especially in treatment. Now, I used to be taking 9 pills a day. Now I take 1.
Amazing.
And of course, that's all due to so many of the wonderful social services that we have here in the Valley. Aunt Rita's and definitely Care Directions being 2 of the main ones.
Thank you so much, Joe. And how about you? What would be your opening remarks?
When I think about HIV and aging, I think there's 2 main points I would want to make. One is that for people who are older adults who are not HIV positive, they need to not think that HIV can't affect them or infect them.
Right.
HIV doesn't discriminate based on age. If you're over a certain age, it doesn't mean you can't acquire HIV. So older adults need to remember that. And for individuals who are older adults who are living with HIV, the great news, like Joe said, we have great treatments now. People are living a nearly normal lifespan, and that's the wonderful news. The bad news is you're aging. And now you have all the issues to deal with of aging, and that's really impacting our population. So you're dealing with the chronic illness of HIV and then all the issues of aging, and they compound each other.
That is very, very interesting. So am I getting it right that the older you get, the more, I guess, the effect of HIV can hit you harder?
It can. HIV, the virus, is already of anyone's age, at any age, causing an acceleration, inflammation in the body.
Got it.
And so some providers would say it's almost like an accelerated aging process is happening.
Got it. Jamie, your opening remarks.
So I think it's important that healthcare providers and that people who are not living with HIV are just staying up to date on their education of HIV and supporting individuals who are aging. You know, there are so many people who are 50 and older who are living with HIV, and they're going to need certain services as they get older, maybe nursing homes, group homes, assisted living. And so it's really important that everyone is being supportive and staying educated about how they can help and how they can provide good services.
You know, it's very, very, very encouraging to hear that the government and the institutions and the infrastructure in our country is becoming better, more supportive for folks who have this diagnosis. Can I ask you a quick question? What is the difference between HIV and AIDS?
So HIV is a virus. HIV stands for human immunodeficiency virus. And it breaks down the immune system over time if it's untreated. It affects the immune system, and eventually it will lead to AIDS, which is acquired immunodeficiency syndrome. So really, in short, HIV is the virus that can lead to AIDS.
And so, but you were telling me, Erica, that even when people have AIDS, it has become transition from HIV to AIDS. People still doesn't necessarily have a death sentence. There's still people can still live with AIDS.
Yes, definitely. It's really just a clinical diagnosis, and it doesn't mean that you're not still functioning well, able to work, able to live a healthy life. And even once someone has that diagnosis of AIDS, their health can also improve. Maybe they never took medications before, and now they start them, and they stay on them, and their health can improve. So I always don't want people to think, oh, I have an AIDS diagnosis, that's the end. It's not the end.
Okay.
There's always help and hope if you're staying on your medication.
It's amazing. It's amazing. I mean, I am so glad of what you and Joe share that is getting better, the support. We're going to get into the medications, the treatments, and how this is improving. So stay with us. This is AARP, Arizona Hispanic Connection. The topic today, HIV, no respecter of persons. Stay with us. We'll be right back. Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection, a show that educates, celebrates, and connects communities. We have three excellent guests with us today, and we are addressing this important topic of HIV, no respecter of persons. We wanted to say no respecter of age. I kind of bounce the ideas. It doesn't matter your age, it could hit you. But then it's not only the age, it's also the ethnicity. And so I said, might as well just make it more, make it broader, and say persons, because persons can be your ethnicity, your race, it could be your age, even gender.
Yes.
Even gender.
Yes.
Imagine. So that's why persons, I think, is a better. Erica, help us understand a little bit in brief about the history of this HIV. I know there has been times in our history where people were like panicking, right? I mean, HIV was like, you are finished, you're dying. Now it doesn't seem to be. Can you kind of relate to us the history of it?
Sure. Well, 1981 was really the first time that doctors started noticing this illness. And it was noticed first kind of on the East Coast and West Coast, where people were getting really sick with these unusual infections that you didn't see often in the United States, or you didn't see in, it was pretty much young, healthy men. And so then during the 80s, this really did cause a panic. What is this? Where is it coming from? How is it transmitted? And so
Right.
in the early 80s, that's what they figured out. It's a virus. Here is how it's transmitted. They got some of the first medications. But those medications were harsh. And some people died from the medication because it was so hard for them to tolerate. And it really was a death sentence for a lot of people because they didn't even get diagnosed until they were so sick. So it was really scary. And in response to that, a lot of great advocacy by the community, by the LGBT community. The first federal funds were set aside by Congress in 1990 to start providing services to this community that was really being decimated. Thankfully, in the mid-90s, our medications got better, and it was the first time we had really effective treatments, and we saw the death rate decline for the first time.
Amazing.
And so then steadily it has declined over the years as our medications have gotten better, treatments gotten better, side effects fewer, and that's really where we are today, is that, as Joe said, there's no longer the need for most people to take a whole pile of meds every day. We have, for most people, one pill once a day. And you take that medication, you're going to get to what we call undetectable viral load, meaning the virus is so low in your body, you're going to get to that within a couple months.
Right.
And you stay on that medication, and you're going to stay healthy, and you're going to have that normal life for, lifetime.
Right.
And it doesn't have the side effects either.
Joe.
And the side effects are so
How
few.
was your How was your experience a little before you got diagnosis, and then when you got it, and then a little after? Just kind of relate to us.
Well, I had lost many friends before I was diagnosed. And as I said, I was diagnosed in 1990, and I immediately went on AZT, which was the first drug that was approved. And it was very toxic. At the time, they were overprescribing it, actually. I had a friend who was taking 18 pills a day.
Wow.
By the time I went on it, they'd cut it down to 9. And that was horrible as it was. I can't imagine doubling that dose. And then the next drug, caused pancreatitis, DDI. And then the first protease inhibitors, which Erica's talking about, the new medications, they were very toxic. It was like being on chemo.
Right.
It really was. So it has changed so much that I can't tell people how much they need to get in and get their diagnosis if they're positive, and get on medications right away.
Right.
Because the longer you wait, the longer the virus grows in your system.
So help us understand, and anybody can jump in. So somebody could have the virus and not know it.
Yes.
And so at what point that becomes transmittable? Depends on the level?
Well, it's transmittable at any time if you have it.
Okay.
And so we're going to talk about someone not treated, not on medication.
Got it. Right.
They're going to be able to transmit the virus. And people can have the virus for years and not know it,
Yeah.
because it can take many years until it really depletes the immune system. So that's why we want everyone getting tested. At least getting tested once a year as part of an annual exam, because the first step in treating the virus is knowing you have it.
The consequences of not doing it could be horrendous.
Yes.
Absolutely. Yeah.
I mean, I'm just, it just hit me right now. So somebody could have it, not know it, sexually active, maybe very active, and that thing is just spreading all over. So from the standpoint of getting it tested, and you said that in your annual exams, you can request it. I assume you have to request it, because if you don't, doctors might not suggest it, right?
Well, my dream would be that every primary care doctor offers it.
And why not?
A lot of them don't necessarily know that that's really kind of the new standard of care. Doctors make decisions about who they think should be tested and who
Right.
shouldn't. So they might have some preconceived biases. So if your doctor doesn't offer it to you, ask for it. There's nothing wrong to ask for it. Don't
Now-
feel bad about that.
Just paint a scenario. And I don't know if I'm going to get in trouble for setting myself as an example. I'm a married man. And if I don't have it, do I need to worry about? We're just, my wife and I, that's it. We're not going around, so in a case like that, should I be tested for it?
So the CDC recommends that everyone get tested at least once in their lifetime.
And then once
So
you
if
know
you've
you don't
never
have it,
been tested,
then
get tested.
most likely you're not going to get it unless you're,
And what I would say is, you know your behavior,
right?
but you don't know your partner's behavior.
Right.
You might think you know, and I'm not trying to say anything
Of
against
course.
your
No,
wife,
no,
but
I get it.
Amen.
but none of us know. All we know is what we do.
Yeah.
And we can hope we know what our partners are doing and that they're being honest with us.
So if-
but
go
I've
ahead.
met many women, and I'm sure it's happened to many men as well, who were in monogamous relationships and ended up HIV positive because their partner was having other relationships.
I heard a comment once that in independent living facilities, any group, settings where people live together, that there's a lot of sexual activity. I think off the air, one of you said that just because you get older, it doesn't mean that you stop having relationship sex. So is there a lot of danger in that kind of activity if people are not being tested?
Potentially,
Absolutely.
yeah.
That could run like
Absolutely.
wildfire.
Yeah.
And some of the issues with sexual activity when people are older, there tends to be fewer men and more women. So that changes some dynamics. Older
What does
adults
that
aren't-
mean? That one man is having sex with multiple women, pretty much?
He might have lots of opportunities for partners because he might be one of the few men in the facility, and he
Amazing.
might, and just also a lot of times older adults aren't worrying about birth control.
Right.
They don't need to worry about that.
That's
so
right.
They
That's
don't
one-
think about condom use.
Right. So that's one point you brought up, that it's just because now you don't have to worry about getting pregnant, it doesn't mean you can, but you should worry about still getting protected because of the HIV. Yeah. Now in and Rita's, right? You're doing, is it clinical research, or what type of research are you doing? I think you mentioned that you either are doing it or are going to do.
Yeah, so Aunt Rita's partnered with ASU to do some research on HIV and aging. And so hopefully in 2020, we'll start an initiative to work with mostly healthcare providers and nursing homes, group homes, skilled nursing facilities, just to educate them about HIV and make sure that they're prepared to work with individuals who are aging and will be coming to their facilities.
So let's get practical here. So if a facility, service provider, they're not competent to understand people that have a diagnosis on HIV, they may not be equipped to provide a good. Now,
Correct.
so can you relate to that, of having received not so good care, or have seen people that because they're not trained?
Personally, I haven't, but
Okay.
I have known of many people who have, because of stigma, because of lack of knowledge, because it's changed in 20 or 30 years when a lot of people in the healthcare profession were trained. And it's an ongoing process all the time, re-educating, and a lot of that doesn't happen.
So we have service providers. They're going to be dealing with people with who have a diagnosis. If they are educated, there's nothing to worry about. Am I correct in the services they provide? I mean, this is not going to be transferred just because you're talking to a person.
Oh, no.
Correct.
So that's where I believe the education and the training comes in, and that's what I believe that you're talking about, right?
Yeah, I mean, it's really important for these healthcare providers to be educated, because it's true, you can't get HIV just by talking to someone who has HIV.
Or touching.
Yeah, or touching even.
Shaking the hand, giving a hug. I mean, no way.
Providing
Or
health care
drinking
services.
Yeah.
What was that?
Or drinking after.
Yeah.
Or drinking water?
Yeah,
There's a lot of
anything.
misconceptions really about how HIV is transmitted. I mean, people do think that if you share a drink with someone, you can get HIV, or if you kiss someone with HIV, that you'll get it.
So you kiss them, it won't. You
No.
touch them,
No.
nothing. It has to be sexually transmitted. Am I correct?
Or birth,
Blood.
through birth.
birth,
And blood.
Blood. So again, so that means that your job at Ann Rita's is super crucial, because you are to be training service providers, and that is I think that is stigma. You mentioned stigma, even discrimination, even
Absolutely. It's still associated as a gay man's disease, and there's a lot of stigma there because of it.
So, have you personally been exposed to a treatment by people and you immediately understand, oh, this person is not trained on this particular matter?
In the earlier days, definitely. Yeah. I can remember going to a dentist for the first time, and he came in dressed in a hazmat suit. So, there were a lot of experiences like that in the early days.
Okay, so the point number one that I thought it was a super highlight for me was get tested. Get tested.
Absolutely.
Get tested, especially if you're sexually active.
Yes.
Okay. And now
Yes.
here we see another aspect, that there needs to be a lot of training of service providers in what other settings? I mean, assisted living, independent living. What other settings do you see the need for personnel to be trained?
I think as we're thinking about older adults and services for them, senior centers, I think gerontologists, these doctors may have had very minimal training in HIV.
Absolutely.
And so for them to understand the latest, so that they make sure their patients getting the best care. I mean, anywhere someone would be getting services.
Perfect. Let's take our second break. Stay with us. This is AARP, Arizona Hispanic Connection. Topic today, HIV, no respecter of persons. We'll be right back. Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. Another very, very important topic. I do believe that, and I hope you do too. I want to remind you that this show is being Facebook Lived, so please go to look for our page at AARP Arizona Hispanic Connection. Follow the page. I think you like it first, and then you somehow become a follower. Those kinds of two things I have never understood, like and follow. But anyway, like it, and hopefully you'll be following it as well. And do help us to reach more people. Internet is unbelievable. I mean, we have folks that listen to the show in other countries, such Mexico and others. So you can really help us spread these messages or these topics that we are addressing. Again, the topic is HIV, no respecter of persons. Why don't we move now to this area of HIV and the LGBTQ plus, because I think we keep adding more letters because we want to be more inclusive, but there comes a point where it becomes a little bit difficult, so we put the plus, right? LGBTQ plus. Joe, how about that? Is the transmission of this virus happening more with the LGBTQ, and if so, why isn't it more people testing for it?
It's geographical. It's when you come to the LGBTQ community, it's in the major cities. Certainly, there's a much higher instance of infection. Why do people not want to get diagnosed? Maybe they don't want to know. Fear can shut you down. What you don't know, it doesn't exist.
Right.
But I think there's so much more talk about HIV now than there used to be. I think it's destigmatized somewhat in certain communities anyway. And I do believe you see commercials on television now for HIV drugs, which you never used to see. There's more of a discussion like what we're having today. And I do believe that once the stigma is gone, I think more and more people will be less afraid to find out the truth and be tested.
Obviously, the recommendation for this group, it seems like to me, would be very, very important to get those tests every year, right?
Yes.
Yeah, because obviously there is sexual activity, just like in heterosexual couples or relationships.
And there are ways you can get tested without going to your doctor. I mean, Southwest Center for HIV and AIDS on Central Avenue does free testing, and so does
Maricopa County Department of Public Health offers HIV testing, other STI testing.
So how do they test
Yeah.
it, and what do they test, basically?
well, it's a blood test, but now
blood.
they have an oral test too
Okay.
Yeah.
Aunt Rita's, you can address that.
Aunt Rita's actually has an at-home test kit through mysterykit.org, and people can go online. They can order a test kit, and it's an oral swab, so they can just put the swab against their gums, and after 20 minutes, they will know if their status, and they can do it in the privacy of their own home too.
Yeah.
Can you repeat once again, a little slower, the places where this test can be done? You said Maricopa?
Maricopa County Department of Public Health Services at
Okay.
16th Street in Roosevelt.
Are they
Southwest-
free?
You know what? I'm not sure if they're free. They're either free or very low cost,
Okay. I
think
and they
it's a sliding
definitely
scale.
work with people, and they can do full range of testing for other sexually transmitted infections. So it's
Right.
a great place to go to really get checked out.
And Joe, you mentioned another place?
Southwest Center for HIV and AIDS, which also houses Aunt Rita's Foundation, as
Okay.
well as 1 in 10, which is an organization for gay youth.
One
in 10.
Oh, okay.
And I believe their testing is free. I know their HIV testing is free. I don't know about the other STD testing.
And then you mentioned Aunt Rita as well, right?
Yeah, so it's an at-home HIV test. So someone can order it, and they can do it in the privacy of their own home. And it's a mouth swab. So people can, really the best site to go to is hivaz.org, because it will walk them through, what is your status? Do you know it? Do you not? And if you don't know it, it will tell you all of the resources available out there so that you can get tested.
Okay, so I believe there's another issue that I think is important to talk about. So somebody could have the virus and not know it. Very dangerous, right? and then somebody might know it, but that person can still be sexually active even though they have been diagnosed. I understand that they can. So how about the partner? If the can you relate? So how does that work? Does the partner also need to be under some kind of medication or treatment or not?
They certainly can be, and that's one of the really exciting things of the last few years is that we now have what's called pre-exposure prophylaxis. We like to call it PrEP. It's much easier to say.
All right.
And it is a medication that people can take, one pill once a day, that prevents HIV. So that if the person is exposed to HIV, they have a positive partner, whatever way they're exposed sexually, if they have this medication already in them, HIV can't take hold in their system. And so if I had a positive partner, that would certainly be a thing I would do. If I was in the community and sexually active and I just wanted to make sure I was protected as a woman, I'd be on birth control pills and I'd be on PrEP. So I explain it a lot to women. It's like a birth control pill. And so the other really great prevention is for everyone who's positive to be on treatment.
Yes.
We call that treatment as prevention.
Okay.
Because if my partner were positive and my partner is on treatment and what we call undetectable, very low virus, that person is undetectable and therefore untransmittable, cannot transmit the virus to a sexual partner.
Got it.
And that's amazing that we really have both those tools, great HIV treatment, prevention methods. I mean, we could really end new HIV infections in the United States by making sure everyone who needs either of those is on them. And it all starts with getting tested. So you know your status and then
Right.
know what path to go down.
And Joe, do you believe that folks who have been diagnosed and then their partners, be it heterosexual or homosexual, I believe I'm using the right terminology here, do they have the confidence in the medications? Do you believe in just your exposure to continue to be sexually active? Are they, I mean, in their mind, are they?
That's an individual thing. I don't know. But
Okay.
PrEP is relatively new. And so I think a lot of people are still adjusting to it because we came up at a time when it meant death. You know, that was my biggest fear, was I would expose somebody else. And so it's taken a while for a lot of us to grasp that. But it's proven. There's all sorts of statistics out there now about U equals U. And it's a whole new world for us.
Yeah, there's so many great resources out there and,
Yeah.
and treatments.
So I have to believe that as people get older, and perhaps if they go to a senior center for fellowship, if they live in independent living, or even there's a lot of interaction there, and it just hit me that of how critical it is, the awareness of getting tested, because there could be, and I'm telling you, I couldn't remember exactly when I heard this, but I heard it, that it was something to be concerned, about in those kinds of settings where there's sexually active folks. And so, okay, so HIV, if a person, how does it manifest itself in a person? Let's say somebody's doesn't go and get tested. So it becomes the virus. How does it manifest itself? How?
In many
Eventually.
different ways. You could. There's a type of pneumonia. There's,
There's so many things. I mean, basically, it is infecting immune system cells that we all have, and it's taking over those cells and making them all HIV cells, and it's weakening that immune system. And so what happens is, if our immune system is weak, we can get these other infections, like Joe was saying, pneumonias, other fungal, viral, bacterial infections that if our immune system was strong, we might be exposed to them and our immune system fights it off. But when it's weakened, we can't fight off these infections. And that's what really makes someone so sick or could kill someone. So that's why you take the medication, so you can keep that immune system boosted and keep the virus low.
Or even pre-existing conditions. For example, I have valley fever, which a lot of people in the valley here have, and it can make that a lot worse if it becomes active. Yeah.
So number one, the safest thing, get tested.
Yes.
Somebody doesn't get tested, then it's probably going to manifest itself in some form of infection,
Correct.
weakness, and then they're going to go to the doctor, and then the process of diagnosis will start.
Yes.
Correct. When does it get to a really, really bad situation? When it's very almost evident that that thing might be present in the body.
If it
Go ahead.
if it's gone too long without being diagnosed, and meds will only work if you have an immune system to build. If your immune system is wiped out, I don't think it can bring it back, can it?
Yeah.
Well, I mean,
Some of them can, I guess.
yeah, I mean, I've definitely seen people over the years who I would say were on death's door, but they ended up in a hospital, they got medication going, and they did rebound. And it's amazing.
Yeah.
I've also seen people where it was too late, but that's why it's just so important. Get tested,
Yes.
get in care, and get on treatment.
The area agencies on aging, Region 1, the program that you run, what do they do, or what do you do for folks?
So we're social workers, we're medical case managers. So we want to help people who are living with HIV find that doctor that they can trust and get care from, get on medications, provide support for them to stay on those medications and stay seeing their doctor. And then we help out with just every other kind of, social service you can imagine. A lot of people might have behavioral health issues, substance use issues, housing, financial issues. So all the things we can wrap around so that their life can be as stable as possible. So that lets them stay in care. We help
Right.
with transportation to doctor's visits, some financial assistance, everything so that you stay in care and stay healthy.
Joe, did you say earlier that you wanted to talk about behavioral health?
Yes.
That arena? Go ahead.
One of the biggest issues for long-term survivors, I believe, is what they call AIDS-related PTSD. In other words, so many of us lost so many people in the 80s and 90s that you just sort of had to shut down emotionally in order to deal with it. And sooner or later, that has to come back. That has to be managed. It has to be diagnosed, and it needs to be treated. And I think one of the biggest problems with long-term survivors is they isolate because of that depression. And I think that's one of the big things that we need to work on is getting people socially active. And there's a group at Southwest Center called Thrive, which is a bunch of HIV positive men who get together on a weekly basis every Wednesday. And there's a sense of camaraderie and community. And it really does help pull you out of that.
Let's take our last break. Stay with us. This is AARP, Arizona Hispanic Connection. The topic today, HIV, no respecter of persons. We'll be right back. Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection. We are addressing a very important topic today. It's called HIV, no respecter of persons. We only have a few more minutes and we want to cover a few more items. People with HIV and even perhaps some of them may have lost their partner, right?
Yes.
So there's a sense of guilt in the survivor. And then if that's not the case, then when somebody has that condition, is there like a tendency to isolate? Is that an issue among the folks that have been diagnosed with HIV?
When you've lost so many people, it's very hard to emotionally invest again in someone else. That breeds a lot of isolation. And that is one of the big issues facing HIV positive seniors, is that isolation and not being able to become emotionally attached to anyone again.
And the guilt, the sense of guilt?
Guilt, there's a lot of people that feel, why didn't I die? Why did my best friend, why did my lover, why did my wife, whatever, why did they pass and I didn't? And I don't have that, thank God, but I do like to live every day fully, not just for my own self, but for all those people I lost.
Let me throw in a question that, do you think that the fact that sometimes the community hasn't embraced the LGBT community, that doesn't allow that community to really invest and understand these matters of isolation? It's almost like, oh, I don't know if I expressed it the right way.
I think I got what you understand.
Yeah.
You mean, do the prejudice against the LGBT community cause them to become isolated?
No, I'm talking about from us, the community, who if we do not embrace the LGBT community, it's going to be more difficult to feel compassionate,
Sure,
to be
absolutely.
understanding of folks who have this diagnosis of HIV.
And that's been a big problem from the very beginning.
Because I was just realizing that, because if we have issues understanding and being accepting of the LGBT community, then there's like a barrier, and I'm not going to see through that barrier.
Correct.
To see the pain, to see the isolation, to extend a hand of support, pretty much.
It happens in the workplace. People are terrified to make their condition known. You can't fire somebody, but you can make it very difficult for them. And that's a big fear as well.
I don't know whether you in your relationships, in your daily life, you relate to 50 plus and younger men. I tend to believe, I've had shows on the LGBT community, I tend to see kind of like a pattern that the newer generations, the younger ones, seem to be a little bit more outspoken.
They're more inclusive, yeah.
And they kind of feel like, you know what, this is who I am and deal with it, kind of thing.
Yeah,
and
bravo.
do you think that the 50 plus older generation is a little bit different situation?
Sure, because that's not the way it was for us.
Okay.
You know, a lot of us had to hide it most of our lives, live
Right.
double lives, and that's true in a lot of the communities. That's why so many women are infected with HIVs, because their husbands are playing on the down low because they will never come out.
Right.
It's a big issue.
Can we move to medications and especially what we still don't have a cure, right, Erica? No
Correct.
cure.
No cure
cure.
yet.
So they're trying new drugs. I mean, what's the hope? What do you see in the horizon? What do we see in terms of a cure?
Sure. So just like Joe was saying, it used to be handfuls of meds, and now it can be one pill once a day. Staying on medication is so important, so we want to work towards how can we make it even easier for people to do treatments. Can we do injectables? Could we get to an injection once a month or every 3 months? Can we get to implants? So things like that make it easier for someone to adhere to medication. I mean, one pill once a day is a lot to think about for the rest of your life.
Right.
Some of us don't even finish a round of antibiotics, and now we're saying take one pill once a day the rest of your life. So
But people who take pills for high blood pressure, they do it once a day too, right?
they do, yeah. And there's lots of things. And I think definitely as we age and more pills become part of our lives, it becomes more routine, but it's a challenge no matter what. So we are looking at things like possible vaccines. Those are studies that are going on. And there's always still that research towards could there be a cure. Lots of science that's above my head, but I know it's out there and that it's happening, and there's definitely hope. But even if those things don't happen, there's almost in a way a functional cure in the sense of you're on your medication, you're undetectable, you're going to live a good, long, healthy life, and you're not going to transmit to other people. Right. So you're healthy, and you're keeping our community healthy. And to me, that's might be as near as good as a cure.
Yeah. And Rita, Jamie, and Rita, and excuse my ignorance, do they have several programs, or basically the HIV is one of their main or their only one?
So, I mean, they do, like I said, they do fundraising for partner agencies that provide HIV services to Arizonans. And then they have a couple programs for testing. So, again, I mean, we've talked a couple times about how important it is for individuals to get tested for HIV. But we offer at-home test kits and a testing initiative throughout Arizona to increase testing locations by 116. So that's really what we're focusing on. And again, the HIV and aging initiative that we're going to be educating healthcare providers and just making sure that everybody is aware that HIV is still around and that people are getting older.
Right.
And we should all be inclusive and compassionate.
And one more thing about women. Now, does HIV originate in males, and then it's transmitted to females, or it can be the other way around?
Yep. Yeah, it's not specific
that
to a
is
gender.
new to me. And I say again, excuse my ignorance.
No, it's good
Is
to
it-
ask.
That's
If you
why
have
we're
this
here.
question, someone else does also.
Yeah.
And ratio, do we have most cases starting with males and then transmitting it to females, or
I don't know the answer to that.
Okay.
I would say when we look at our population of individuals we serve, a greater percentage are men. But in terms of where it started and who transmitted to who, I don't know. It's not really something we track, and ultimately, doesn't matter.
Doesn't matter.
We're
Yeah.
here.
But it's good. I think it's important to understand, because if like you said, if it was somewhere in my brain that it started with males,
Right.
then but it's not the case.
Right. We
The
shouldn't
infection-
live with that idea of thinking if I'm a certain type of person, I'm not at risk.
Yeah.
Like Jamie said, the H in HIV is human. So any human who's sexually active, injection drug user, breastfeeds a baby, I mean, there's a potential of transmitting HIV.
Let me go ahead.
HIV doesn't discriminate, is what I
Right.
like to say. I mean, it affects everyone, and so everyone should be getting tested, and no one should have an issue with that either. I
Right.
mean, it's just part of staying healthy.
Right. And what you just said, it doesn't discriminate, is another way of saying no respecter of persons. It doesn't
Correct.
matter who you are. Let me try to make sense of a note I have here from Glenn. He says about 15% of women who deal with their own unique issues of stigma and isolations, since the myth that HIV is a gay disease leads to even greater isolation for them, since people may assume that they were a prostitute or injection drug user, not normally the case, since most contracted through heterosexual contact from partners or husbands.
Correct.
That's a good statement, isn't it?
Glenn is well spoken.
Let's kind of be moving towards concluding this program.
Yes.
I believe you keep mentioning, or at least I keep getting that the condition of HIV tends to get worse or more difficult as people age. Can you just say a few words about that?
Well, yes, because you also have other conditions, genetic conditions, and HIV can just complicate that. For example, I have glaucoma, which I inherited from my mother, but usually you're in your 60s, and I was 42. And we do believe that HIV may have caused it to come to the surface earlier. So you do have the complication of HIV on top of what other health issues you may be genetically inclined to have.
Is that because your immune system tends to get weakened?
Well, that's because of the inflammation.
Well, talk about the inflammation. Anybody, I think that word we cannot leave the show with us saying a few words about inflammation. What is that?
Well, it's just, if you think of your inflammation is like your body is just running at full speed. And so everything's working at this high level. Well, things are going to break down and burn out. We can't keep that up.
Right.
And so when our bodies are doing that and fighting HIV, it just makes it harder then for it to fight other things. And then, like Joe was saying, there's, as people age, cardiac issues, renal issues, just all the things that can happen with aging, and it might happen a little sooner. And HIV can cause some of those issues, and then you have an aging body also causing that to happen, so it's just compounded.
Why don't I give you half a minute of just final thoughts, final words, just like you did your opening remarks. What would you tell folks out there in terms of this show, this issue? Let's start with you, Joe.
Well, first of all, HIV is not a gay disease. I think that's one of the biggest misunderstandings that is out there right now. And number two is get tested. It's so easy to do. And it can take so much weight off your shoulders if you know.
Let's come to you, Jamie.
Yeah, I would agree with what Joe said. Is people should be getting tested. Again, HIV doesn't discriminate, and it's something that we should all be doing is getting tested regularly and just being educated. How is HIV transmitted? How do you prevent HIV? What can I do in my life to support individuals living with HIV? And I think,
I'm positive, about my relationship with my wife, etc. I think you know what I mean by that. but because of this show, the next time I do my exam, I'm going to get tested. I'm going to get tested just because of this show. Your final thoughts, Erica?
I think removing stigma is just so important because removing the stigma about only certain types of people get tested, or that if someone is positive, they must have done this or that. Let's just remove that stigma, and then we can offer that helping hand to the person who's positive, and the person who's positive doesn't have to live in fear of rejection. And, you live your life like that, you're not going to take the best care of yourself. You're not, going to be invested in you. And so I'd love to see the end of stigma in our community about HIV. Let's not be afraid of it. Let's deal with it.